Gurvinder Gill is a clinical pharmacist, and does have primary care and oncology experience. He's a doctor of pharmacy program, and he has done a lot of research and articles on this profession, how this a pharmacist is playing an important role, and he will provide you important information. And the information he will share with you today, and that will be supply and of the medications. Gurvinder.
Hello everyone, welcome. I'm Gurvinder. I'm a clinical pharmacist. So I will give you some information regarding the medications. You have questions regarding your medications. So I hope I can answer all your questions. We don't have that much time, but if you have any questions, if we haven't talked about it in the slide, you can ask questions later on. We will focus on insulin. We will talk about how often and when should I be checking my sugar, how to manage low blood sugar, and the focus will be the insulin. Unfortunately, in our community, there is a scare about the stigma about the insulin. Actually, A1C numbers, it can lower it, so it's very beneficial as compared to the other medication. They are also beneficial, but there should be no stigma about it. And the end, we will talk about the diabetic supplies, whatever things you need to manage your diabetes. So we will talk about those things, but the folks, how you can handle your diabetes. So in the beginning, I want to talk about when we are diagnosed with diabetes. Dr. Chima explained to you in very much detail. Metformin is started in the beginning. So it's been used to manage in our community for many, many years. And it has very little side effects, minimal effects. But there, with the new research, there are so many other medications in the market. So they work those medications work in a different way. They could be given along with the metformin. So our try is, if we can lower the sugar level in by any method. There are other medications too. How we the sugar is made in the liver and is distributed. Our pancreas, that's the one who makes the sugar, the insulin. So we should tell the pancreas create more insulin so that it could be distributed. There is a new Jardiance, there is a new medication. So their medication, when sugar goes in the urine, by the time it reaches to the kidney, then it comes back to the body. There is a new medication that sugar could be drained through the urine. Excessive sugar should be drained through the urine, and then less sugar will be absorbed in the body. There is medication that also suppress your appetite, and then it also could be given via injection. There are other medications that can control your sugar level. Every medication has a side effect. There is no medication that doesn't have side effects. So you talk to your doctors which is fit for you, what side effects they have, and what is good for you, and then how you can manage those side effects. There are medications, but if we cannot control or it doesn't fit you, then we have other methods, other options. So on this slide, as I told you earlier, A1C should be checked every 3 months. So this is the standard. You can talk to your doctor and get it from your doctor. So they can give you requisition up to 1 to 2 years. So you can go to the Life Lab and get it done. As Dr. Chima told you earlier, this urine test. So check before you go to the doctor then you can give information accordingly. Where is your situation, how much control you have on your diabetes. Usually according to the life lab it takes 1 or 2 days to get the blood, and then you can check your blood test.
Now, to check the sugar level, what's the benefit of it? The referral program we have, doctor can send you to attend diabetes classes and how to check your sugar levels. There are other options. If you go to your pharmacy, they can tell you about all the machines and give you education how to use the machine. Why do you need to check the blood sugar level? But patients who are just taking one pill of morphine, they don't need to check every day. There's no need for daily testing. Then they just need testing. If they feel low sugar, they can check it. There are other medications as well that, because of side effects, they have low sugar chances. In those situations, then they need to check blood sugar level many times a day. Insulin is another example. When you use that injection of insulin, then you should know what your sugar level is. So then you can inject appropriate dose. And there are two different ways of doing it. One is base the one time used one time a day, that works. On top of that, there's extra, if dose needed, then that's extra dose. That's the one given with the food. Then when that dose is used, then you need to check the sugar. As I shown in the chart here,